Hello all and welcome to the Reinhardt's Rundown. We've been reviewing clinical pearls about topical dosage forms, specifically topical corticosteroids, a really common medication class that gets prescribed. We're dropping notes below on videos about dosage form and potency, and today we're going to continue our chat about application. We have topical corticosteroids that come in tiny little 15-gram tubes and others that come in these big giant pound jars. So how much do we apply, and is there a strategy behind measuring it? Remember, there's about 15 different topical corticosteroids available by prescription. They vary greatly in potency, strength, dosage form. Also remember that dosage form matters, with ointments being more potent than creams and solutions, and gels and foams being the least potent. Most often, creams and topical products come with that super generic instruction to apply to affected area. This can be tough. In general, a good rule of thumb to consider is the FTU, or the fingertip unit. This is essentially meaning that if you squeeze out cream from the tube onto the fingertip, starting at the end and going to the very first joint, that's about 1/2 of a gram. This amount from the fingertip to that first joint, this is about the amount necessary to cover one side of an adult's hands if you have the hand held out flat and the fingers are together. So we could cover this surface area right here. If the affected area is smaller than your hand, you likely don't even need a full FTU. This would be a great example of when to use a pea-sized amount. Keep in mind that if you're an adult and you're applying to a child, this means that measuring on your fingertip will get you twice the coverage area on the child. So now measuring out one adult FTU will cover the surface area on a child of 2 adult hands. Let's look at the other side of this. What do we do when we have a large area to cover? For example, if we have a rash on someone's legs or their entire back, we might need a much larger amount. In general, it takes about 20 to 30 grams of cream or ointment to cover the entirety of the adult body. Products that come in a 1-pound jar or a 454-gram jar, like triamcinolone, really might be necessary if we have that large of a surface area. Whenever possible, of course, you want to use the least amount necessary to prevent side effects like thinning of the skin, changes in pigmentation, telangiectasia formation, which is those little blood vessels that can form at the surface of the skin, and challenges with infection and irritation of the skin. That's the Reinhardt's Rundown, and we'll see you on our next video.